This is live.
It says live. What do you say?
Yes.
Yes, it's on a page.
It's on the page.
Mm-hmm.
Yes.
Okay, and we are live.
Yes, it's on a page. Mm-hmm.
Okay, so this is our first time doing this. So welcome. We want to welcome everyone to ABSW DC chapter's very first town hall meeting, Facebook. So bear with us if anything looks a little frozen at times, but we're excited to be here. So today we're going to have a town hall meeting on a very, very important topic. And it's about Black men maintaining their mental health during this epidemic, this pandemic, COVID-19. So we want to hear from you. We want to hear everything that you want to say or share with us. But today, this evening, we have a very special guest, Dr. Jimmy L. Wilson and Sasha Y. Stewart. I will introduce Ms. Stewart and she will introduce Dr. Wilson. Okay. And my name is Anjan Glad. I am the chapter president of the DC Metro. So Sasha Y. Stewart has a master's from Howard University. She completed her MSW studies in 2019. She's currently employed at a community-based agency providing case management services, utilizing a housing first model approach. So introducing Sasha Stewart.
Thank you. So we're excited to be here this evening. Tonight we have Dr. Wilson, who has a PhD in social work from Clark Atlanta University and is a mental health professional providing individual, family, and group therapy. Tonight we are discussing just the effects on the pandemic, the coronavirus COVID-19 pandemic that it has on the African American male communities' mental health. In particular, as you guys know, this virus has been going on since possibly December of 2019. Reportedly, we've been having many cases that are more prevalent since February of this year. And as you may or may not know, the Black community in particular is most affected by this virus due to the disproportionality and the prevalence in the Black communities due to Black communities having more health issues or more health comorbidities and possibly not having the healthcare services that are needed. So, Dr. Wilson, why is the Black community or the Black males in particular more affected in this virus?
Well, I think that as you well know, the Black males are, in that category where we are, when it comes to health disparities and those kind of things in our community. I think that's one of the reasons why we are affected. When you talk about pre-existing conditions and things of that nature, those are things that lead to the fact that we are, just more subject to healthcare concerns in general.
Yeah. So I know we're not going to go too much into the healthcare aspect of things, but being that this virus is going on, and being that it's had such a prevalence in the Black communities, I'm curious to know what are some of the stressors that Black men are experiencing during this time.
Well, I think that there could be a number of stresses. I think one of the stresses that Black men are experiencing is the fact that they must provide for their families, especially those who are essential employees. And if you're an essential employee, you must provide for your family, and therefore, there are various work conditions that you have to work in. For instance, when I was I was going to have something done on my car, and of course, I noticed that a lot of those men were not wearing masks. When you have, and of course, I basically asked them why they didn't have masks on, and they basically said, well, no one gave us a mask. And of course, what I tried to do is basically, as a matter of fact, I had some masks and I gave them some masks. But the bottom line is, a lot of our people are essential employees, and they have to work in places like drive buses and work in the grocery stores and things of that nature. And that's just that can be a stress in general. And the whole idea of taking care of your families, we have to take care of our families. It's a matter of survival. You talk about survival, you talk about health, you talk about survival. And number one is you got to provide for your families in spite of the virus, in spite of what's going on. And all those things are just important. You got to provide for your family. You have to make sure that your family is safe. But it's more important that Black men themselves, they have to stay safe. Because if you don't take care of yourself, you cannot take care of anybody else. And so what I'm trying to stress is that Black men need to take care of themselves, number one, in order to be able to be there for their families and their loved ones.
Yes, I agree. I agree with that. And I think that along with those essential employees, I think a lot of Black men who are, possibly not working, it may be a challenge for them worrying about financial aspects, or even the thing where people are being social distancing and quarantined and having to stay home with their families and not being able to have that space. Do you think that Black men or people in general know the effects that this virus will have on their mental health? Like what do you think that they're aware? Do they have such an awareness to the effects that this will have on the mental health?
Well, I think it depends upon the Black man. I think it depends upon, the educational level of that particular person. I think it depends upon the exposure to various things. To give you an example, those persons, I think it's important to realize that, when we talk about Black men, we're talking about a variety of Black men. And we can't forget any of our brothers and sisters, but when you talk about Black men who are homeless, Black men who are incarcerated, Black men who are dealing with HIV and AIDS, Black men who are living on the streets, in shelters, in cars, those who don't have adequate housing, don't have adequate restroom facilities, all those concerns. So you're talking about that group of people, who are certainly affected by this virus, who certainly have the resources to be able to combat this virus. So that's important in general. So when you talk about that, you talk about people who are basically disproportionate, people who have not necessarily, people who don't trust. Because in general, when it comes to the medical community, especially the white medical community, we always bring up the Tuskegee incident, and that always comes to mind. So it's this whole idea of not trusting certain sources, not trusting certain, especially, those institutions that are predominantly don't look like us, and that's why I think it's important that we educate our people. It's important that we go to resources, that have the best interests of our people at heart and what our people would trust.
Yeah. That brings up a good point as far as what resources do you think are available for Black men during this time?
Well,
or like what resources can they turn to?
Well, I think that one thing I think that we need to do first of all is make sure that we take care of ourselves psychologically. And therefore, if you have access to any type of therapeutic services, anybody that deals with life coaching or deals with therapy in general, and you just need to talk to somebody, I think it's important that you take care of yourself, mentally. That you realize that we're living in a stressful time. We live in a time that we have to practice social distance. We have to wash our hands. We have to just do a whole lot of things. And I just think it's important that you take care of yourself mentally. That you take a break from this, that you stay away from the news every now and then, that you take a walk in your neighborhood, that you do some things with your family or with your loved one, or if you just live by yourself, you just take some time to just breathe and just sort of relax and sort of debrief. I think that's important. So I think it's important that we take care of ourselves psychologically, mentally, those things that's the first thing. And when it comes to and so forth, taking care of yourself, physically, making sure you're eating right, make sure you're dieting right, make sure you're exercising, those kind of things that help us to stay strong, that help build our immune system and that kind of stuff. And if you're a person of faith, then you take care of yourself spiritually. You turn to the faith that you believe in, and you practice that, and you take that with you wherever you go.
Yeah, I think you raised some good points. I know that the black men in my life that I speak with, I know that a lot of times their outlets may be going to the gym, and right now they don't have that access where they're able to go to the gym to de-stress, or they're able to go to the barbershop and get a haircut. I know men not being able to even get a haircut may have an effect on themselves and maybe even their self-esteem. They're walking around woofing, needing to shape up. Along with that, being able to go out and play basketball. I know a lot of places close down the basketball courts. So what I know, there also has been a stereotype about black men not seeking therapy, not seeking mental health services, not really being in touch with themselves emotionally compared to their woman counterparts. How do you think you can get a man to really seek therapy or seek that type of support? Or I don't know. What are your thoughts as a therapist, as a mental health provider?
Well, I think it's important that we encourage black men to go to therapy. I think that people like myself, you know, who's a trained therapist, basically try to encourage people that it's okay. You can be a man and still need mental health. You can be a man and still need to talk to somebody. I think it's important to hear from other men, other men who have been in therapy. A lot of my clients are men. A lot of my clients are millennials. They're younger men. We have some men that are maybe older men, but a lot of the younger men, they seem to be okay with that. They seem to be more open to therapy. But I think we have to take that stigma away, that we all hurt, that we all have pain, that, we all have needs, that we don't have to be so macho where we don't have to, decompress and those kind of things. And so I think it's important, that we share that. I think the women who understand the men in their lives, or their significant others who understand them, they need to stress the fact that you need to take care of yourself mentally. If you need to talk to somebody, talk to somebody. I think that everybody in the country needs a mental health therapist, and they should see the mental health therapist at least once a year. Just like you see your primary care physician, you ought to have a primary care therapist, because especially with black men, you deal with a whole lot of things. You deal with racism, you deal with discrimination, you deal with racial profiling, those kind of things. I was just reading an article where this doctor in Miami was arrested at his home because he had a mask on, and the police, the law enforcement, handcuffed him and said he was being disrespectful, and finally let him go because his wife, he got his ID and ran it through, et cetera, et cetera. But even when it comes to wearing masks now, they said that a lot of black men have been racially profiled because they wear a mask. A lot of them being racially profiled because they don't wear a mask. So when you think about the environment that we live in, you need to talk to somebody, because if you don't talk to somebody, you might explode.
Yeah, yeah, that's good. I think you broke it down good. Um, Dr. Wilson, what do you think are good opportunities that Black men can take advantage of during this time with being quarantined, being social distance? I know we talk about like the challenges that they may face during this time, but what advantages do you think that they can take advantage of?
Well, I think one advantage you can take advantage of is take advantage of rest. If you're unemployed and you're not working right now, you're working from home, take advantage of just resting, because I think that, our bodies get tired, our minds get tired, the stress, and sometimes we don't realize how stressed we are until we stop and take a breath. And I think that during this time, this is the time of just sort of taking a rest, sort of taking an inventory of where you are, and sort of begin to set some goals for your life, begin to do some things differently. You may want to begin to, start your journal. You may want to begin to start your vision board. There's so many things you can do. Take advantage of that, and then you may, just like we're Zooming and Facebooking here, get with a group of friends and, Zoom, Facebook, come up with some creative ideas, come up with an idea for a new business, text somebody, come up with something that will benefit you as a person and that will benefit the community as well. Those kind of things. Create a routine in your home, where you get up at a certain time, you do certain things at a certain time, you exercise at a certain time, you have some me time if you're with the family or what have you, and then you create things, just create a new ritual in your home, and I think that those things will be certainly beneficial as it relates to just sort of planning, vision casting, those kind of things, that will certainly help us as we plan our future and deal with what they call this new normal.
Yes, this is a new normal. Let's see if we have any questions here. As I go through the questions, Dr. Wilson, how are you? How are you as a Black man taking care of your own mental health?
Oh, well, that is a good question, isn't it? No, no, what I do is I try to create a routine every day, and of course I've got, my whole family's created a routine. We get up at a certain time and we have breakfast at a certain time. And of course I have some kids that are in college, they have to do, they do academics at a certain time. We have lunch, we we take a time where we have some me time, where everybody takes a break, exercise, talk on the phone, read, do whatever you need to do in that case, and then there's a time when you just stop. There needs to be a cutoff time, So I do that. I take walks in my neighborhood. I walk my dog, and of course that little dog gets on my nerves, but I walk my dog, and that's very therapeutic for me. So those kind of things. I have Zoom meetings with some of my colleagues. I'm drafted to do certain things by the president of our association and that kind of stuff. So that kind of keeps you busy, kind of keeps your mind busy. And I've taken this time to work on some projects that I would not normally work on. There's some things that I'm trying to research as it relates to fathers and this whole concept that I have called marketplace fathers that I'm trying to research. So I'm taking our time to do some research and those kind of things that sort of just helps expand my knowledge. I guess everybody has become what they call the chief innovative officer. So, everybody's become a chief innovative officer at this time and be creative, and use this time to be able to just plan for the future, because this virus won't last forever. Eventually, we will get a handle over it, and eventually life will go back to quote unquote normal. But we have some new ideas and some new projects and a new vision for our lives. So that's what I've done during this time. And I talk to a therapist if I need to talk to a therapist. I know many. So when I get really stressed out, I call a therapist and they help me to, keep things in perspective.
Since you touched on that you speak to a therapist, I know a lot of Black men, possibly I know a lot of like my generation of Black men, they have a challenging time finding a therapist. What are your resources? Like where do when they locate a therapist? I have like therapyforblackgirls.com, but that's more so I think geared towards women. So what do you recommend that men go to seek therapy or mental health service?
Well, I think one thing, if you're looking for a Black mental health professional, I think starting with our organization, and that's, the Association of Black Social Workers, the DC chapter. So I think that if you contact our chapter and ask for a therapist, we have a lot of Black therapists. Matter of fact, everybody there is Black, so I think that that's important. And we have a lot of men that are therapists. So, if you're looking for a Black therapist, I think that's a good place to start. There are a lot of places that have therapists, but if you look for the African-American therapist, I think that's a good place to start. And if you do that, we'll be able to connect you to somebody, and take it.
Yeah. And yes, that's good. And also sometimes I recommend people to go to like Psychology Today, or even if you do go through the therapyforblackgirls.com, possibly reaching out to one of the therapists and seeing if they know of any male Black therapists, or even I don't know if men have a preference of seeing a male or female Black therapist.
It just depends. Yeah, it just depends. I have some clients who specifically ask, they specifically ask to speak to a Black therapist, a Black male therapist. It just depends. And, so you just, and if you're looking for a Black male therapist, just say that's what I want. Even if you contact psychology today or whoever you contact, let them be very clear. I want a Black male therapist. I want somebody who's in my culture who can understand me. And I think that makes a difference, when you have somebody that can understand you, that understand your struggles, that understand what it means to be a Black man, that understands all those kind of things that goes along with that. I think that helps sort of break the barrier of Black men seeking therapy. But every Black man in America needs some therapy.
Yes.
So, and that's not to be a joke, but that's just absolutely true.
I agree. Everybody can use some help and somebody to talk to, non-biased.
Absolutely.
So I see that we have a few questions, Dr. Wilson, that I'll go to.
Okay.
We have a question here. It says, I believe that social distancing and quarantining our children are taking a toll on our children as well. How do we help them? So I know our topic is really geared towards the Black men. So I guess like during this time, even as a father, like how do you help your child during this time and maintaining your own mental health and helping your child that may be a Black male or Black boy to manage himself or stay interactive and like balancing throughout this time?
Okay, so I assume that the child is in the home. Well, we give two scenarios. If the child is in the home, then what you basically would do is basically, like I said, I have to create a routine. You have to create a routine for your child. If you create a routine, and create and have certain expectations and help your child sort of create rules with your child. You know what I mean? You create rules with your child. These are the rules of what we're going to do while we're in the household together. What do you think should happen? What do you think should do? When do you think playtime should be? When you think that and of course, academics probably, depending on the age of the child, the academic time is already set, because I know in PG, it's like from 9 to 1 with kids now from Monday through Thursday, but, bring the child into planning, plan with the child about the rules, create things like movie nights, and you still can create things like father and son time, if it's just you and your son and you in the home, so we know that, you all are properly safe. You can go out in the backyard or what have you and throw ball or play ball or take a walk or, those kind of things as relates to your son, or you can do that with your daughter as well, So I'm just saying, create a routine in the household, where you do things together, where you exercise, where you talk, and it's a good time to share something about your legacy. It's a good time to share something about your family. It's a good time to let your children know about their grandfather, their great grandfather, and just share legacy, share stories, that you would ordinarily do. This is a time that's bringing about communication, and I think that's important. Communications, movies, have discussions, and kids, depending on the age of the kids, kids like being around their parents. They enjoy the contact with their fathers and their mothers. So I think that should be fairly easy if you just sort of create a routine.
Yeah, and I agree with that. And I think that just to add on to that, I think that it's important that as a parent that you have a balance, that you also have your time as well. Even if it's when the child is sleeping or when they're doing homework time or when they're outside playing, that you have you time because you have to be okay in order for your kids to be okay. So you have to restore your energy, so you're able to give good energy out to your child as well.
Absolutely. And if your child is not with you, you can do FaceTime, those kind of things, Skype, that kind of stuff to just sort of keep that connection until you're able to meet physically again.
Yeah. So we have another question. Okay. It says, how do you bring the topic up? How do you start the conversation with the Black men in your life about mental health? Okay. So I'm guessing it's how do you bring up the topic of mental health? Like, how we discussed, sometimes it is a stereotype where Black men don't really seek mental health services. How do you bring that topic up? Or how do you I guess let them know the importance of that, or bringing awareness to them.
Right, right. I tell everybody all the time that men have big egos. All men seem to have big egos. And if you can feed that ego, you can probably reach that man, and most of the time. But my thing is that you take a loving approach. You say to your father, or you say to your husband or your significant other, whoever, you say to that person, you know what, you're the most important person in my life. And I want you to know how much I love you. I appreciate you. You are awesome. You've been a great influence to me. If it's a husband, you've been a great provider. If he is a great provider, I guess you've been a great provider. You've done excellent, and I really appreciate you. But one thing I've noticed you've been stressed lately. I noticed you looked a little worried. You look a little pale. You know, and I noticed that there've been some things that have been worrying you. And what I think would be important, if that have you thought about seeking some counseling, or somebody to talk to? You don't necessarily have to say therapy, somebody to talk to, somebody to share your feelings. Because I know sometimes as men, you all think that you're strong, but it's okay, And I'm concerned about you enough that I think maybe you need to talk to somebody professionally. How do you feel about that, sweetheart, or whoever? How do you feel about that? I think if you take an approach out of love, take a loving approach, take a diplomatic approach. You know the person better than I do, so you know what their hot buttons are. But I think if you come in a loving way and say, I am concerned, I care about you, I appreciate you, and I think if you take that approach, I think maybe that will break down the ice and open the door for some dialogue.
I like that. I like the way you put that. Um, Another question we have is, what about instances when a man is completely against seeking therapy? What are some strategies that we can employ to either help them understand the benefit or find alternative mental health avenues? Okay. So yeah, so how can you so we have the circumstance where, we try to soothe them in with kind of tending to their egos, but they're just like not hearing it. They're not interested in therapy services at all. So what other ways do you think we can support them with their mental health, or what other avenues do you have to get them to see the benefit of it?
Well, I mean, you have to come up with strategy, and that's going to be the difficult part. You have to come up with strategy. You have to come up with some kind of intervention in order to reach that person, without knowing that person's personality and stuff. But let's just give some hypothetical situations. If a man is totally against therapy and really don't want to go to therapy, one thing that has been effective in some cases is that you have a surprise intervention. You have a surprise intervention where you have people, you have family there, and you might even invite the therapist in that person's not aware of. And maybe you have a surprise intervention where you all basically share your concerns about what's happening. And if you do that, that may or may not work. Sometimes it does work. I remember, when it came to, my brother who was an alcoholic, and of course we were concerned about him, and about his ability to function. So we did have a surprise intervention. We had my aunt, we had my sisters, we had myself, and we all sat down and said to him how much we love you, how much we appreciate you, how much we care about you, and and he broke down. He broke down, and we broke through that barrier, and he did go and get some help. So I think that having a surprise intervention might work. If that does not work, then you might have another male to talk to him. Sometimes men receive things better from men than they do from women. Sometimes
Yeah.
women can say the same thing to a man, and he don't receive it. Then a man can say the same thing to a man, and he receives it. I don't know why. I don't know what that is. Like, maybe that's an ego thing. But I'm just saying, if you have another man, that person has some respect for, and if you have a man who's really gone through therapy, who's had a mental health therapist, I think that would help break the ice as well. You just have to either find a way, as Clark Atlanta would say, find a way or make one. And I think that there's a way that we can get through anybody. It's just a matter of finding that way. And you might need to talk to a professional therapist in order to be able to try to see how you can reach, your male friend or your father or the male person in your life. So there's all kinds of ways to do that, but those are just two examples that I can come up with right now.
Yeah, I think those are good examples, and especially with the social work practice, we make emphasis on meeting people where they are.
Right.
If they're not ready, they're not ready. If you're able to just have a conversation with them on a basketball court, if they're into basketball, that's meeting them where they are and not forcing them. Let's see, what other question do we have? In what ways do you think it might be helpful for others to speak to Black men so it's about seeking therapeutic support and normalizing help-seeking behaviors. Okay. So that's kind of similar to what we just discussed. Yeah. So I think normalizing is a big thing for right now. I think that's kind of across the board, normalizing seeking therapeutic services. And then for Black men, I think that's has been more of a challenge, where it's normal.
Yeah, and I think probably having forums like this a little bit more, and probably having Black men in these forums who have gone through therapy and who's basically said, I went through therapy, I'm not ashamed, and this is what happened to me. I have a lot of, and people go through therapy for different reasons. Loss of a loved one, low self-esteem, sexual issues or sexual dysfunction issues, all kinds of issues. And what people have to realize that we all have issues. And those things that are in Black men's heads are in a lot of our heads, and we have to be more transparent. We have to be more open, about our pain, about our hurt. And I think when men begin to be more open about their pain, about their hurt, I think that it will certainly bring the wall down. We have to bring the wall down as it relates to mental health and as it relates to mental health and dealing with, Black men in therapy, because, we hurt, we cry, we have fears, and most of the time people do things out of what? Either out of love or out of fear, and we keep stuff so balled up inside of us until we end up getting sick or end up having strokes or end up having heart attacks. And we need to let all that go. If we love our loved ones, we need to let some of that stress go. And if it means seeing a professional, we need to see a professional, and I think sometimes maybe even writing a letter, because sometimes if they don't hear you, maybe they can read it and they can feel your pain through the words on that letter, but we just have to come with interventions. But I think forums like this, and having more conversations like this, and people seeing more Black men talking and expressing themselves and saying, look here, I went to therapy, it helped me 100%. So I think that hearing from other men who've gone through the experience, who've had the same pains that you've had, who come out much more healthy than they were before they went to the therapist.
Yes, I agree. Thank you, Dr. Wilson. So we have another question. What type of recruiting can we do to get more Black male clinicians?
That's a good question, huh? What can we do to get more Black male clinicians?
Yes, can we recruit Black
Well, I
men?
think that as it comes, especially with HBCUs, as it comes to schools of social works, I think that if you have people that's trying to recruit to the school, I think we need to send people out, to various undergrad schools to talk about the need for Black clinicians, to talk about what it means to build a Black healthy male community. So I think recruiting through the HBCUs would be certainly an avenue to do so. I think that's one strong way. I think if we recruit and we go to schools, and not just to Black undergraduate schools, but if we go to some of these other undergraduate schools that have, Black populations and Black males in them, to recruit. I think that's going to be important. I think we have to sell ourselves. I think we have to sell ourselves. So like people announce that, you want to be a social worker, come get an MSW. we need Black clinicians. Come get your MSW, be a part of that, or get your counseling degree or whatever kind of degree you get. But I think recruitment is going to be a good thing.
Yeah, I think there's definitely a deficit of Black males in the helping field. We have another question. It says, with the pandemic, the barbershop is a holding space for bonding and connecting, and that has been lost. How can we creatively connect to that population?
Well, I think if you know, but I'm not a barber, like you see my head is I have no hair, of course. I've been, I shaved my own head lately. I miss my barber as well. And that's a difficult question because I think if I don't know whether barbers have a barber association or not, a Black Barbers Association. I'm not quite sure what they have, but I think if you're trying to connect barbers to barbers, I think that they ought to have an association where they zoom in like everybody else. But I'm not sure how to answer that question as it relates to. Just hope that when this social distance is over, that we can get back together on that. But if you have a personal relationship with your barber, talk to your barber. Maybe your barber can give you some tips on how to cut your hair, how to stay trimmed, and those kind of things. But even in the barbershop, there's so many other discussions we have, besides just cutting your hair. You talk about issues that you have with your women. You talk about issues that you have with your children. You talk about things like, I know there was one barbershop that brought in a therapist, and they were doing therapy in the barbershop. So that was powerful too. So I just think that you have to sort of, if you know your barber personally, connect with your barber. My barber's texting me, and I've texted my barber back and said, when social distance is over, and I'll come see you. But until then, good luck to you. But I'm not sure how you do that during this particular time as it relates to connecting with your barber. If you got friends, stay in contact with your friends, and continue to connect that way.
Yeah, I think that with everything closing down and the social distancing being in play, I think it's bringing a lot of awareness to the little things that people found value in and that we never realized during that time. But the hair salon and the barbershops are a big one. Let's see if we have other questions. Okay. Okay. So I think that's it for the questions here, Dr. Wilson. Virtual barbershops. I meant to say Patron to barbers in that network in the shop. Virtual barbershops. Yeah. Okay.
Virtual barbershops. Okay.
I've seen barbershops out here in DC where they have it like a barber in the truck, but I don't think they're doing that during the social distancing time. Okay, so I think that's it, Dr. Wilson. I don't know if you have any closing remarks or anything.
Yeah, let me just say that I think this has been a very good discussion. And I think that as Black men, we need to continue these type of conversations, because our mental health is important, and we deal with a lot of things on a daily basis. And we don't have to be ashamed. When we become stressed, we become stressed. When we hurt, we hurt. When we feel pain, we feel pain. And then there are things that are joyful. Share the joy of things too. Share the joy share triumph in your life. Share things that happen as a result of therapy. But I think that it's important that we take care of our mental health. Because as I said before, if we don't take care of ourselves, we can't take care of anybody else. You have to take care of number one. You got to take the remote back from other people who are trying to control your life, and you change the challenge. You decide what you're going to do and what you're not going to do. But it's important that you take care of yourself, physically. It's important that you take care of yourself mentally. It's important that you take care of yourself spiritually. And I certainly appreciate the opportunity of sharing today.
Thank you, Jimmy Wilson and Sasha Stewart. This is definitely an important conversation for us to have today, especially what's happening in our community, in our communities within the African American communities, and also Black men. There's a lot of Christine Bagwell just posted a resource, Therapy for Black Men. .org website. And this was such a rich conversation that we had today. And I thank you guys for coming here and sharing with us. And also for the audience here for jumping in, chiming in, and having questions. Let me see, because I also had posted this on mine. And I know there are people probably asking questions maybe there. So let me just scroll on over there. Okay, so why are Black men afraid to become clinicians? They will stay as case managers, but not clinicians.
Well, I don't know why Black men are afraid to become clinicians, because I know several Black men that are clinicians, but I think that I think it's important. I think it's important that, Black men can reach Black men, and a lot of people are comfortable with people who look like them, so I think I think that's important, and, it's a good field to go into. And if you're a good therapist, you can make a good living, But I think you have to have a heart for what you do. I think you have to have a calling for what you do. I think you have to be committed to that, committed to empowering people. And as therapists, we empower people, and we need more Black men empowering Black men.
Mm-hmm. Let me ask you a quick question. I was thinking while you guys were talking about Black men, mental health, and COVID-19. Some of Black community are either they're working or not working. So what advice would you give a Black male who has to take care of his family? He's not presently working, and or his significant other is not working, and they have to leave out to grocery shop. How do you maintain your mental health while you as a Black man have to sustain your family?
Well, you said now, is the Black man working or not working?
Not working.
Okay, and the other person may be working in the home.
Mm-hmm.
Okay. Well, number one, I think that as a Black man, realize that, hey, it's not your fault that you're not working. If you've been laid off, that's not your fault.
Mm-hmm.
This virus that came out of nowhere is nobody's fault. So don't start feeling guilty and blaming yourself for something you can't control. Okay. And if you got a good support system, or you got a good spouse or a good significant other that's supporting you, then embrace that support, and don't feel like you're not carrying your weight, because you did carry your weight before. But, that's the whole idea of having a partner. That's the whole idea of having somebody that's working as one, so don't feel guilty, be glad that you have somebody that is working in the household, somebody that can provide, apply for unemployment, do whatever you can do, get all the stimulus you can get. But in the meantime, just feel good about who you are. Stay focused and realize that this too shall pass. It's the whole idea of, you do the best you can, and your best is different on different days. Your best is different when you're sick. Your best is different when you're well, and your best is different when you're unemployed. So you do your best, and that's all you can do is do your best. So you're trying to be the best, just do your best. If you do your best, I think you will always come out victorious, and I think you'll always come out healthy. So I think that's what's important.
Okay. Well, thank you for that, Jimmy Wilson. For those of you chiming in, Jimmy Wilson is our steering committee rep for the DC Black Social Workers chapter, along with Sasha Stewart. And we're so proud of them coming out here on this Wednesday evening. Our topic, again, is Black men maintaining their mental health during this COVID-19 pandemic. And we are hashtag Black Social Workers Speak Wednesdays. And we will be here every Wednesday this month. And we have other topics that will come. But not to take away from this important topic, I thank you again, Jimmy Wilson, for speaking for the brothers. I know this was a topic that you wanted to bring to address, for us to always remember the men, the Black men, and to always talk about, some of the challenging successes that he's facing. So as we close this evening, what Sasha as well as Jimmy, I'll start with Sasha, And then Dr. Jimmy Wilson, you can close us out. But Sasha, as a Black woman facilitating with Dr. Jimmy Wilson, what are your takeaways and what are your last words of advice as a clinician that you would like to leave us with this evening?
I think my takeaways is for people that are surrounded by Black men to be patient with them and to also meet them where they are. You know, if they're not ready for therapy, just bring an awareness to them in a simple discussion, or play basketball with them, or take it with them, and just provide those, if they are ready, provide them with the resources that are needed, and that goes across different age groups of young men to older men, to middle-aged men.
Yes, I think that, and I certainly concur with Ms. Stewart on everything that she said. And I just have one statement, that this is your life and live it well. This is your life and live it well. And living it well means that you take care of yourself, psychologically, mentally, realize that you are not a Superman, realize you're not superhuman, and realize that, we hurt, we fall down, we get back up. So this is your life, live it well. If you need some mental health services, go out, run and get them. It takes a real man to say to someone, I am hurting and I need some help. And that's strength, and that's not weakness. And I challenge every man to deal with that kind of strength.
That was an excellent takeaway. Sasha, what do you think?
I agree. That was one.
I felt that. And I thank you again. So Facebook, this is the ABSW Metro DC chapter bringing you hashtag Black Social Workers Speak Wednesdays. We are here again with Dr. Jimmy Wilson and Sasha Stewart, bringing to you Black men maintaining your mental health during COVID-19. Join us next Wednesday. And real quick, I'm going to tell you what our topic is, if you bear with us. We are going to talk about relationships. How are you maintaining your relationships during this COVID-19? Some of us live alone. Some of us don't live alone. Some of us do live alone. But how are you maintaining that? So join us so we can talk about relationships, friendships, isolation. What is it doing to your relationship with your children, with your significant other, or no one, if you're home alone? Important topic. But today, this evening, I have been blessed. I have been enriched, and I thank you for joining us. And I thank you for, again, Dr. Jim Wilson and Sasha Stewart. So have a good evening. Take care of yourself. Do your best and be your best. Take care.
Thank you.
Thank you.
That's right. Thank you.